If you're preparing for PEBC Exam 2025, then there is one topic which you cannot afford to skip, and that topic is anaphylaxis, that life-threatening allergic reaction which demands immediate action. So the question is, what is anaphylaxis? Anaphylaxis is an onset emergency that affects multiple systems. That includes respiratory, cardiovascular, skin, and even your gut. Symptoms can include wheezing, hypertension, hives, vomit, and in severe cases, shock or airway obstruction. And what's the drug of choice? That is epinephrine, administered intramuscularly, 0.3 mg to 0.5 mg. This is the only medicine proven to reduce mortality. And let's discuss some common triggers that are involved. That includes eggs, shellfish, peanuts, medicines like penicillin, NSAIDs, insect stings, latex products. Diagnosis is clinical, but there is no time for lab test. If patient shows sudden respiratory distress and hypotension after pollen exposure, then immediate treatment is very important. And here are your emergency protocols. Number 1 is call for help. Number 2, administer epinephrine. Number 3, lay the patient flat with legs elevated. Number 4, monitor vital and provide oxygen. And number 5, follow up with antihistamines and corticosteroids if needed. For PEBC candidates, understanding anaphylaxis isn't just about passing exam. It's about being ready for real-world emergencies. You will be expected to recognize symptoms, counsel patient, and how to use an epinephrine auto-injector confidently. Hope you found this video helpful. If you found this video helpful, like this video, share this video, subscribe to Elite Expertise for more such latest updates, and yes, don't forget to hit that bell icon.